Welcome to the module on ABDM, Mythbusters for Doctors and Patients. At the end of this learning module, you will be able to understand and address the common concerns that doctors and patients may have about using ABDM. There are two broad concerns for the users of the ABDM. 1. Patients and consumers like Radhika, Rahul's wife, are concerned about the privacy of their health records. 2. Medical practitioners like Dr. Rashid and healthcare facility providers are apprehensive about the tracking of their engagement with patients and consumers. Let's try to demystify their concerns and apprehensions. As we discussed in previous modules, ABDM only maintains a list of patient records and not the actual patient records. ABDM does not store any patient information. For example, when Rahul gives access to the laboratory report to Dr. Rashid's clinic, the actual lab data continues to reside with the lab facility and shared with Dr. Rashid for defined time period. All information pertaining to the patient continues to be stored where the information was created. For example, laboratory reports will remain with the laboratories, and hospital records will remain with hospitals only. Even Dr. Rashid, who was given access by Rahul, can see and access the lab data for a period for which Rahul has given consent. No one can see Rahul's lab test results without his approval. On the other hand, Rahul can choose to store a copy of his health records on his personal device or health locker. It must be understood that ABDM will only collect patient transaction data at a regional and a broad level, and that too to identify any trends in health-related cases. This feature will provide meaningful insights in the future to help health authorities and researchers to identify trends in population, health, disease patterns, risk factors, etc. Now let's see how the concerns for healthcare professionals and health facilities get addressed in ABDM. Some doctors may be concerned that the government can track them in terms of the number of patients consulted and fees collected. In ABDM, there is no way to track the number of patients met, the fee charged, or treatment offered at an individual level. Hence, ABDM cannot track the overall business of a doctor or hospital. In this module, we learned about aggregation and anonymization of data for research and policy makers, non-tracking of businesses or practice of professionals. For more information on ABDM, visit the ABDM website and follow us on our social media handles.